Hello guys, welcome back to Medico Days. So in this video, we'll be discussing all the 300 questions of the Fmge July 2025. So these are recall based questions, and guys, if at all you have any queries regarding this, please do mention in the comment box, and you can also discuss in my Telegram channel where we will have a discussion about the questions with students, and we will also be participating it, and we can clarify our queries about the questions. So guys, and if you are someone who is preparing for Neetpg 2025, then please go through the Fmge questions, because every time Fmge and Neetpg questions, they are related because the board is the same, and some questions from Neetpg come in Fmge and some questions from Fmge come in Neetpg. So this is always a trend. And if you're someone preparing for Neetpg, don't forget to check out the Neetpg PYQs as well, very important. And I have uploaded 7 years Neetpg PYQs in my channel. You can check out them in my YouTube channel itself. And if you are someone who want to revise all of the Neetpg PYQs in just a small span of time, then you can check out my PDF, which is available at a very nominal price, guys. And I'm also providing coupon codes, and if you guys are interested, the link is there in the description. Now moving on to the details of this video. First question. So all the questions, I have compiled them into subject wise in this video. And anatomy: nerve injured in foot drop. Answer is common peroneal nerve. Next, a patient presented with sensory loss on the lateral aspect of leg and dorsum of the foot. Level of lesion is L5. Next question: identify the nerve. It's an image based question. A type of hypersensitivity in borderline tuberculoid leprosy. Answer is greater auricular nerve, and type 4 hypersensitivity. Next, root valley affected in Erb's palsy. Answer is C5 and C6. Next, identify the bone. Image based question. Answer is navicular. Next, a T4 level esophageal constriction is produced by. Answer arch of aorta. Next, notochord gives rise to. Answer nucleus pulposus. Next, image of an uterine abnormality, and this happens due to defect in fusion of. Answer paramesonephric duct. Moving on to physiology questions. What describes stage 3 in the diagram? Efflux of potassium ions. Next, true regarding the effect of increase in neuronal axon diameter, increased conduction velocity. Next, a 22-year-old man presents with complaints of weakness and numbness in his right arm and hand after a night of heavy drinking and falling asleep with his arm draped over back of a chair, which accurately describes the order of susceptibility of the nerve fibers in this condition. Answer is A fibers more than B fibers more than C fibers. So this mentions about the susceptibility to pressure. Next one, a lady from Delhi went to Leh and felt some discomfort. What will be the mechanism? Hypoxia. Next, true about the given nerve action potential. Image based question. Point B to D is the refractory period is the answer. Moving on to biochemistry questions. Patient's diet consists of only eating rice and pulses. He came to hospital with a stick. Which of the vitamins could have prevented the disease? Answer vitamin C. Next, definition of electron volt. Answer unit of energy. Next, image based question of genovalgum deficiency is of vitamin D. Next, child with abdominal distension, enlarged liver by 8 cm below the costal margin. Diagnosis is glycogen storage disorder. Next, patient has hypoglycemia and hypoketosis. Answer is carnitine deficiency. Next, a breastfed infant presents with lethargy, hepatomegaly, and cataract. Enzyme deficiency responsible for this is Galpert. Next, major intracellular antioxidant in detoxifying rows. Answer is glutathione. Next, orotic aciduria and elevated ammonia. Answer is ornithine transcarbamylase deficiency. Next, which vitamin deficiency causes lactic acidosis? Answer thiamine. Next, tenin-sarcoma. Answer is familial hypercholesterolemia. Next, a patient with fasting hypoglycemia and hepatomegaly, enzyme deficient is glucose 6-phosphatase. Next, a 6-month-old infant is brought to the emergency room with lethargy, vomiting, and poor feeding. This episode occurred after prolonged fasting. Lab results reveal hypoglycemia, low ketone levels, and hepatomegaly. Disorder is MCAD deficiency. Next, moving on to pathology question. A 17-year-old male who has long arm span and long limbs and arachnodactyly condition is because of fibrillin mutation. Next, 5p deletion is seen in Kruduchat syndrome. Kaposi sarcoma causes what lesion in the mouth? Answer purple red. Next, FBN1 gene is associated with. Answer Murphy syndrome. Klinefelter syndrome genotype is 47XXY. Next, Bernard-Solier syndrome is associated with GP1B9. Next, image-based question with hair and teeth. Answer mature teratoma. Next, patient with blackish pigmentation of lips. Condition is Peutz-Jeghers syndrome. Next, SOD1 gene mutation is seen in amyotrophic lateral sclerosis. Next, non-Hodgkin's lymphoma patient translocation is 814. Next, patient with parathyroid carcinoma and red protoncogene is associated with MEN2 syndrome. Next is a pedigree chart. Answer is adopted. Next, tube for coagulation study. Answer tube with blue colored cap. Next, congruent stain shows blue-green. Answer is amyloidosis. Next, what is seen in Barrett's esophagus? Answer squamous to columnar metaplasia. Next, histopathological image with child having history of eating soil. Answer is iron deficiency anemia. Next, a 67-year-old male with lymphadenopathy and fatigue. Biopsy image is given. CD markers associated as CD5, 19, and 20 and 23. Next, ground glass opacity is associated with. Answer hepatitis B. Next, a 55-year-old male with heart failure. Endoscopy showed velvety mucosa admixed with white mucosa. Red velvety areas show presence of goblet cells. Next, 19-year-old girl with menorrhagia. Diagnosis Plummer-Vinson syndrome. Next, translocation in anaplastic large cell lymphoma. T25. Next, pro-apoptotic gene, answer is Bax. So guys, regarding this ground glass opacity, if at all, please check out if the other options like silicosis or something was there in this. So guys, it is a little doubtful question. Please, if you have an idea, do mention about it. Next, pro-apoptotic gene, Bax. Next, patient presented with seizures and headache. Gross image of brain is given. Type of necrosis is liquefactor. Vasophilic stippling is seen in. Answer, lead poisoning. Lady on cetirizine feels sleepy. Alternative drug is fexofenadine. Falciparum malaria oral treatment is artemisinin combination therapy. Opioid antidote is naloxone. Patient on atropine presents with. Answer, dry mouth and blurred vision. Psvg drug of choice is adenosine. Bleomycin side effect is pulmonary fibrosis. This patient taking medicines developed dystonia. Antidote is benztropine. Skin graft was done on immunocompromised patient from another immunocompromised patient. Weeks later, patient developed contractures and systemic symptoms. Causes graft versus host disease. Next, patient presents with chronic hypercalcemia for last 1.5 years, but PTH levels are normal. Causes sarcoidosis. Next, 25-year-old man with headache, visual disturbances, hypertension, MRI shows cerebellar hemangioblastoma. RCC suspicion is also present. Father had similar condition and died at 40 years because of ring tumor. Chromosomal anomaly related is deletion of chromosome 3p. Next, neuropraxia refers to intact axon but damaged nerve sheath. Microbiology questions. Organism causing necrotizing fasciitis. Answer, Streptococcus pyogenes. Smear is related to. Answer, herpes simplex. So, organism with 11 to 22 mm size, cytoisospora. Next, in which condition is umbilicated papule seen? Answer, molluscum contagiosum infection. Next, gas gangrene is caused by. Answer, Clostridium perfringens. Next, a person is an animal lover and has sheep. Infection seen is Coxiella. Next, most common organism in heart aneurysm, Staphylococcus. Person, history of people going for picnic. They ate food from Pani Puri Salagoi, leading to gastroenteritis. Organism causing it is E. coli. Next, which antibody is first to appear and acts faster during primary immune response? IgM. Next, crush ping pong appearance. Pneumocystis cerevisiae. Candida is cultured on chromogar. Female came with retained Taman history. Toxic shock syndrome. Next, hand-foot mouth disease is associated with Coxsackie A16 and enterovirus A71. Next, male eating salad, cheese and milk. After 3 hours, he developed diarrhea. Causative organism is Staphylococcus. Next, culture media for Sporothrix. Answer is SDA. Next, overall health status of a population is determined by. Answer, infant mortality rate. Next, dentist with lesions on the hand. Answer is herpes simplex virus 1. Next, Hashimoto's disease. Answer is anti-TPO antibodies. Next, HPS is increased in. Answer, sickle cell anemia. Next, hypercalcemia is seen in. Answer, sarcoidosis. Next, chocolate agar is used to grow which organism? Answer, Haemophilus influenza. Next, most common organism associated with heart aneurysm. Answer is Staphylococcus. Next, history of people going for picnic. So this is a repeat question, guys, and instead of that, there was a question related to blowout fracture which had come twice. So you can check out on that question and you can have a discussion about it in my group. Next, image-based question, Staphylococcus scalded skin syndrome. Next, CSF showed abundant neutrophils with low sugar and elevated proteins. Diagnosis is ABM. Next, a person had a dog bite. What is the test to diagnose it? Answer, fluorescence antibody. Next, pharmacology, tell me certain mechanism of action. Decreased peripheral vascular resistance. Next, a 12-year-old child presents with palpitation, tremors, dry mouth, tachycardia and respiratory rate of 34 per minute. Most likely causes physostigmine. Next, a 58-year-old patient weighing 70 kg administered a drug with half-life of 3 hours and volume of distribution of 100 ml per kilogram. Clearance is 1670 ml per minute. Next, a patient with peptic ulcer disease presents with arthritis and develops carditis. Most appropriate anti-inflammatory drug is celecoxib. Next, a patient came with eschar on abdomen. Drug of choice is doxycycline. Next, triple drug regimen for treatment of H. pylori, omeprazole, clarithromycin and metronidazole. Next, patient with asthma is on inhaled steroids and LABA and continues to have exacerbation. FEV1 is normal. There is no improvement with salbutamol. Symptoms worsen seasonally. Most appropriate next step is increased dose of inhaled steroids. 94th question is about Achilles tendinitis and leg swelling after taking an antibiotic. Adverse effect is associated with fluoroquinolones. Mechanism is inhibition of bacterial DNA gyrase and topoisomerase 4. Next, male presented with hyperpigmentation in the axillary region. He reports similar incident every time he takes cotrimoxazole. Diagnosis is fixed drug eruption. Next, drug of choice for treating cluster headache, sumatriptan or oxygen. Preferred or preoperative drug for managing pheochromocytoma. Answer is phenoxybenzamine. Next, current treatment for peptic ulcer disease associated with H. pylori, PPI plus antibiotic. Treatment of esophageal varices, liver cirrhosis, octreotide. First line treatment for hypertension in patient with CKD and proteinuria, telmisartan. Next, a patient is taking 3 antihypertensive medications including diuretics but BP is not controlled. Which drug should be used? Answer, spironolactone. Next, patient with amenorrhea and galactorrhea, MRI shows pituitary adenoma, prolactin is increased, management bromocriptin. Next, patient with progressive pallor and bone pain, and elevated HbS. Best treatment to manage hemolysis is voxelotor. Next, true about AC inhibitors. They decrease BV by decreasing the peripheral vascular resistance. Next, a patient presents with blackish colored material in the nose and posterior part of buccal cavity. He also gives history of taking high dose steroid in the past. Drug of treatment is amphotericin B. Next, risk of breast cancer is reduced by OC pills use except endometrial carcinoma. Next, a patient with osteoarthritis for last 3 months is taking ibuprofen and developed occult GI bleeding, causes prostaglandin E2 and prostacyclin production reduced. Next, in patient with head injury which leads to inability to understand and explain things, part of brain affected is Broca's area. FMG questions. Patient presents with lung injury and tympanic membrane rupture following blast exposure. Level of blast effect is level 1 primary. Next, a doctor got 2 summons, one to appear in court for murder case, another to provide expert opinion. And doctor should prioritize appearance in the murder case. Next one, a man abducted from his home and his trans tries to claim his property. How many years he cannot get the property according to BSA? Answer 7 years. Person was found dead in swimming pool. On autopsy, stomach and lungs were filled with water. There was evidence of mucoid froth at the nose and the mouth. Likely mode of drowning is wet drowning. Next, during an explosion, person sustained crushed lower limb injury because of collapse of building. Type of last injury is quaternary. Next, baby with multiple injuries over the chest and abdomen along with knee fracture. Answer is battered baby syndrome. Next, patient working in sand mining industry, condition is silicosis. Next, patient working in cement industry, condition is asbestosis. Next, steroid postmortem staining, answer carbon monoxide poisoning. Patient with injury on the face, type, answer is declogging injury. Next one, businessman went abroad. So this couldn't be changed, guys. This is a repeat question again. But I have added few questions in the end, like about a fluoride case and about the vitamin C cases, so you can use them instead here. Next one, community medicine. Patient with increased consumption of Vajra now complains of drowsiness and giddiness. Diagnosis is ergotism. Contamination in Willows tag is checked by fluoride level, Langlier saturation, water hardness index. Person moves from Nigeria to USA. Which vaccine should he take? 17D. A study was conducted among nursing staff to find out the time taken in different aspects of patient care. Management technique would be applied for analysis, work sampling. Next, in a female phase lasting from birth of last child to first child, complete extension. Cotton swab after cleaning goes into yellow non-chlorinated. Under open vial policy, 2 vials are open, 1 pentavalent, 1 MMR, which can be reused. Discard MMR, use pentavalent. Next, individual speeches on common topic. One person summarizes the whole type of communication symposium. Next, Arogyadan, Arogyamandir, Arogya Lakshmi is related to foot. Technical plan for schizophrenia or mental disease. Answer is telemenace. Next, there is a total population of 10,000. 100 of them got TB, out of which 30 cured and 10 died. Later, 20 were diagnosed with TB, out of which 5 cured. Incidence and prevalence are 2 by 1000 and 12 by 1000 respectively. Next, in normal distribution, calculate 2 standard deviation range for 95% values, 85 to 125. Then which of the following includes registration of birth, death, IMR, abortion, pregnancy, marriage and contraception? Answer, National Family Health Survey. Next, a study is conducted among factory workers of 20 years duration and to study the relationship between aniline dye exposure and bladder cancer. One group was working in aniline dye factory and another group working in factory office as clerical staff. The duration of exposure was obtained from past records. Study is retrospective cohort. Next, in a study, investigator took 2 different groups. Mean BP and SD were calculated and compared. Statistical test of significance is unpaired t-test. Secondary prevention is useful in cervical cancer. Patient got burns in a factory. On evaluation, he is found to have 25% burns. Later, he developed infection and complications. He is eligible for which act of ESI? Answer, extended sickness benefit. Next is an image-based question. Answer is biomedical waste. Next is a person came from Assam with leg pain. Image is given. Which of the following will you measure? Answer is fluoride levels. Next, MEC1 for OCP. Answer is HIV. Next, correct treatment used. Vaccine vials should be discarded in blue bag. Next, secondary cancer prevention includes early screening and treatment. Next, measles vaccine is a type of live vaccine. Next, vaccine gender pain is which type of data? Nominal, normal and ordinal respectively. Next, water not suitable for drinking purposes with cadmium 0.3 value. Next, E&E question, sign in MRI, image-based question, black turbinate sign. Next, sign, patient presents with fishbone stuck in the pyriform sinus. During removal, there is accidental injury. Nerve affected is internal branch of superior laryngeal nerve. Narrowest part of adult laryngeal airways glottis. Next is a surgery performed IBQ. Answer is total maxillectomy. Next, a professional singer presents with difficulty in raising pitch of her voice following thyroid surgery. There's no hoarseness but high-pitched voice production is impaired. Nerve injured is external branch of the superior laryngeal nerve. Type of abscess on face from the image, IBQ. Answer is zygomatic abscess Next, tip of uncinate process is attached to. Answer, middle turbinate. Next, a patient with fall from height presents with ear bleeding. Investigation of choice, CT temporal bone. Next, patient presents with high frequency hearing loss that worsens in noisy environment. Diagnosis is presbycusis. Tympanogram image, AS. Next, a patient has stridor and cannot be intubated. Next step to maintain airways, cricothyroidotomy. Next, 5-year-old child comes with repeated infection, dull retracted TM with fluid behind it. Answer is otitis media with effusion. Next, adult was intubated and on mechanical ventilator for a week. He develops inspirated stridor. Answer is subglottic narrowing. Next, adenoid hypertrophy. Identify the type of tympanogram from the image and treatment. Answer, B-type adenoidectomy. Next, ophthalmology questions. 20-year-old girl on beach vacation presents with sudden onset severe eye pain, photophobia, blurred vision. Frequent use of contact lens while swimming presents, and also poor lens hygiene is maintained. Answer, acanthamoeba. Next, image-based question, Herbert Spitz. Next, myopic patient with deep anterior chamber complaints of flashes and floaters. Answer, ecmatogenous retinal detachment. Next, image-based question, posterior staphyloma. Again, image-based question, exotropia. Next, patient with sudden onset eye pain, redness and decrease in vision, hazy cornea, mid-dilated and fixed pupil. Answer, acute angle closure glaucoma. Next, terms conoid is used for astigmatism. Eye manifestation of ulcerative colitis, uveitis. Next, little lesion at the base of the eyelash and gland affected as Zeiss gland. This patient presents with down and out right eye with ptosis since birth, nerve palsy, third nerve palsy. Nerve compressed in superior orbital fissure syndrome is 3, 4, 6 and V1. General medicine question, patient with chest pain and V1 to V6 leads showed ST elevation. Answer, anterior wall MI. So if at all there is a V1 to V6 completely involved, then there is also a chance of acute pericarditis. So please throw more light on this question. Electrolyte abnormality encountered after packed RBC transfusion, hypocalcemia. In myasthenia gravis, antibodies are targeted against postsynaptic acetylcholine receptors. Patient with irregular pulse opening snap and mid-diastolic murmur. JVP finding absent A wave. KF ring seen in Wilson's disease. Pituitary adenoma. Answer, bitemporal hemianopia. Next, early diastolic murmur. Answer is aortic regurgitation. Next, retroorbital pain and body aches. Answer, dengue. Next, child with 20% burns, low urine output after 6 hours, cool extremities. Next step, answer, give bolus of 10 ml per kilogram. Next, severe head injury, poor GCS, normal CT with death within hours. Answer is diffuse axonal injury. Next, IVU image shows decreased delayed excretion, calcial blunting. Diagnosis, hydronephrosis. Next, gustatory sweating after parotidiectomy, Fraze syndrome. Next, young boy with joint swelling after a fall, normal PT and raised APTT. Diagnosis is hemophilia. Next, HNPCC gene defect, MMR gene. Next, SIADH is associated with small cell carcinoma. Image-based question, answer is IVP. Wilson's disease, answer is ceruloplasmin levels. So this will be the answer if at all liver biopsy is not there in the options. Next, patient with progressive shortness of breath for last 6 months accompanied by dry cough. Auscultation revealed bilateral basal end inspiratory crepitations. There is no history of fever, joint pain, occupational exposure. Diagnosis is idiopathic pulmonary fibrosis. Patient is in ICU after failed attempt of subclavian catheterization, VB drops and pulse rises. Diagnosis, pneumothorax. So guys, I'm a little doubted about this question. So if at all it was asked whether which structure is injured or what is the diagnosis, so please mention about it. Next, and you can have a discussion in my Telegram channel so that we all can find out the correct answers. Next, a patient after RTA has a renal shutdown. FeNA value is less than 1%. Urine osmolality is 500 milliosmoles per liter. Diagnosis, a doubtful question, acute tubular necrosis or prerenal EKI. Next, a patient with HBsAg positive IgM and HPC negative IgG, anti-HPC positive, HBAg positive. Best treatment is lamivudine. Next, RTA patient is passing red colored urine. Which of the following can be seen in him? Answer, hyperkalemia. Patient with M spike on serum electrophoresis. Prognosis is by albumin and beta-2 microglobulin. Next, patient with MI developed broad QRS complex tachycardia. BP is 90/70. ECG is given. Management, amiodarone IV. Next, Guillain-Barré syndrome, AIDP. What is the cause? Answer, demyelination of A beta fibers. Next, 24-hour urine metanephrine values are elevated. PP is 180/100. Diagnosis is pheochromocytoma. Next, bronchopulmonary segment resection. Which structure is commonly injured? Answer, pulmonary artery. Next, patient with diarrhea and exophthalmos. Answer is Graves' disease. Next, undiagnosed hypothyroidism. Perioperative complication is arrhythmia. Next, young patient experiences shortness of breath specifically during exercise in winter which subsides after using salbutamol because of exercise-induced bronchoconstriction triggered by cold air. Next, people with low BP in childhood tends to have low BP in adulthood also. Answer, tracking of BP. Next, patient is 23-year-old, asymptomatic, diagnosed as mild AST. Treatment is reassure and no intervention. Next, you prescribe an antihypertensive drug for how many days for a patient in OT who has sudden onset hypertension and who is not a known case of hypertension. So this is a doubtful question. If you have an idea about it, please do mention about it. Next, opening snap and loud S1 present in patient. Answer is mitral stenosis. Next, general surgery question, young girl with lacerated thigh, triage is green. Next patient underwent split thickness grafting for burn injury on arm. On post-op day 6, he developed stiffness of arm during physiotherapy. Next step, continue physiotherapy without intervention. Next recommended treatment for esophageal varices, endoscopic ligation. 2-week old infant presents with high conjugated bilirubin levels, dark colored urine and clay colored stools. Infant appears jaundice but is feeding well. Diagnosis biliary atresia. Not eligible for daycare surgery. Patient without an attendant at home. Next image of breast with skin dumpling because of infiltration of Cooper's ligament. Segments resected in left hepatectomy 2, 3, 4. Next correct segment of damage control surgery. Identify the patient, control of hemorrhage, ICU resuscitation and abdomen closure. Type of ulcer with irregular edges, shallow base and pigmentation. Answer is venous. Which of the following is affected in varicose vein? Answer great saphenous vein. Identify the suturing technique. Answer subcuticular. Next, a 2-year-old child has scrotal swelling since birth. Now it is now painful, irreducible and red. Diagnosis strangulated hernia. Next patient is diagnosed with 8 cm chyliolymphatic cyst. Treatment is enucleation. Patient underwent laparoscopic cholecystectomy 4 days back. He now has right upper quadrant pain. USG shows collection. Next step is USG guided drainage. Next patient with GRD has a nodule in the second part of duodenum which hormone levels is to be measured. Gastrin. Next neonate has intestines protruding from abdominal wall without covering. Next step is cover with silo bag and weight. Next 14-year-old with testicular pain and absent chromastric reflex. Next step is exploration of testis. Next penetrating chest trauma with tracheal deviation. Immediate step is needle decompression. Next identify the image. Answer is mammography. Next investigation of choice for extrahepatic biliary atresia. Answer is MRCP. Next is an image based question. Answer umbilical hernia. Next ulceroproliferative growth over the face of a patient. Answer is basal cell carcinoma. Investigation of choice for hydronephrosis. Answer is DTPA. Next, which other structure is injured other than the great cardiac vein? Is EABG surgery, posterior descending artery. Next, OBG questions, concentration of fixative for pap smear 95% ethanol. Next, working woman 48 years presence with 9 months amenorrhea. Her mother advised her it's normal and as she is attaining menopause. What will the doctor advise her? Answer is reassurance and no intervention is needed. Next is an image-based question, uterine inversion. First maneuver for shoulder dystocia. Answer is macrobirths. What is Ridgen's maneuver in obstetrics? Answer is prevention of perineal tear. In ectopic pregnancy, how frequently should BDI-HCG be repeated? Every 48 hours. Next, investigation of choice regarding non-stress test. Doubtful question, please do mention about it. Next, variable deceleration in fetal heart rate is associated with which condition? Answer cord compression. What is partograph used for? Answer fetal heart rate of 120 to 140 can be seen. Normal partograph. Next, core test. What tests are used for cervical cancer screening? Answer HPV plus pap smear. Next, image-based question, Hagar sign. C-section is done. Postpartum hemorrhage presence despite oxytocin. Management is uterine artery ligation. If at all it's a vaginal delivery, then the answer is balloon tamperon. Next, OC pill do not protect against which type of cancer? Answer cervical cancer. Investigation used to diagnose fetal anemia. Answer is MCA Doppler. Next, best investigation for heavy menstrual bleeding, endometrial hyperplasia. Answer hysteroscopy and biopsy. Next, if placenta is invading the bladder, diagnosis is placenta percreta. Next, in vacuum assisted delivery, where should the cup be applied? 3 cm anterior to the posterior fontanelle, which is the flexion point. Next, in phase presentation during labor, which diameter is engaged? Answer submentopragmatic diameter. Next, precocious puberty is commonly associated with hypothalamic hamartoma. Next, cervical cerclage procedure, image-based question. Answer modified Shirodka cerclage. Next is about the Bishop's score, station minus to 50% if is 2 cm dilated, soft and MP. Answer is 7. Next, primary amenorrhea raised as a female, absent uterus 46XY. Answer is AIS. Next, history of DNC and LH and FSH is normal. Answer is Asherman syndrome. Next is the case of obstructed labor. Answer is Bandel's ring. Next, vaginal protection is by perineal structure. Tannel stage. Answer is peak height and menarche. IUCD absolute contraindication and diagnosed vaginal bleeding. Long-term reversible contraceptive, a doubtful question. Most probably the answer should be IUCD, but I'm doubted whether this question was there or not. So if you guys know about it, we can discuss about it in the Telegram channel. Next, perineal tear at delivery, rectum is spared and less than 50% of external anal sphincter is involved. Answer is 3A. Next, partogram alert, line crossed but not touched. The action line management is ARM and also oxytocin. Next, 36-year-old woman who is P2L2 with recurrent endometriosis. Management is total abdominal hysterectomy plus bilateral salpingo-oophorectomy. It's contraindication to subdermal implant. Answer undiagnosed genital bleeding. Next, to about endometrial hyperplasia, gold standard hysteroscopy. Patient with early pregnancy with sporting indication of abortion is no cardiac activity and crown drum length more than 7 mm. Next, 2 questions. I'm doubted whether questions were there because some of them were telling questions were related to these topics were there, but others were telling it's not there. So guys, if you have an idea, please do mention it in my Telegram channel. We can discuss about it and we can find out what were the options and what is the correct answer and what's the question. Next, breast duct development is by cause of estrogen. Next, pediatric question. Mother came with baby who was given BCG at birth but no scar appeared over the injection site. Now reassure the mother. EEG shows hypsarrhythmia. Preferred drug is ACTH. Boot shaped heart. Image based question. TOF is the answer. Child presents with Kawasaki with multiple large coronary artery aneurysm. Treatment is aspirin lifelong. Next, 4-month-old infant comes to emergency with respiratory rate 66 per minute, chest intruing, nasal flaring, baby is not feeding, diagnosis severe pneumonia. Next, child with recurrent sinusitis, repeated lung infection, genetic test shows mutation in CFTR gene. Gold standard is sweat chloride test. Next, 12-year-old presents with short stature. On evaluation, bone age is less than the chronological age. No dysmorphic features. Child is otherwise healthy. Answer is constitutional delay of growth and puberty. About this question as well, some of the students were telling me that the bone age was mentioned as it is much more than the chronological age. So all that are little confusing. So if you have more idea about it, we'll discuss about it in our Telegram channel, and we'll be finally getting into a conclusion. Next, a 9-month-old baby is brought to OPD. Which developmental milestone is likely to be present? Answer: creeps well on hands and knees. Which of the following is harmful to newborn? Giving a bath immediately after birth. Next, most common congenital heart defect in Turner's. Bicuspid aortic valve. Orthopedics questions: image of knee X-ray, IBQ. Answer: Brody's abscess in an RTA. Patient presented with externally rotated leg, loss of dorsiflexion of foot present, injury at ward level. Answer: neck of fibula. 60-year-old fell in bathroom. Which fracture? Intertrochanteric fracture is the answer. Person with fracture femur got admitted. Third day he developed breathlessness. Fat embolism is the answer. Humerus shaft fracture. Nerve injured is radial nerve. Image based question. Next one: blowout fracture. Next, fracture of neck of femur. Management is internal fixation. Next, ligament tested in the image. Answer is ACL. That is anterior cruciate ligament. Next, diabetic patient had injury to palm, loss of sensation and paralysis of middle and ring finger. Structure affected are mid-palmar space. Dermatology questions: patient presents with redness, swelling and characteristic skin nodules that are tender and painful. Undergoing and treatment for leprosy. Next step in management is continue with the treatment. Painful blister of a penis, cancroid. Psychiatric questions: 30-year-old man comes to psychiatric clinic with complaints of not able to work properly and difficulty balancing family and work. Disorder is acute stress syndrome. Next, 26-year-old male believes that he is very rich and people are trying to kill him. He appears depressed and physically unwell. Diagnosis: delusion of grandiosity with persecuted delusions. Next, 36-year-old woman presents with hyperactivity, reduced need for sleep, excessive spending for last 2 weeks. On questioning, she gets irritable. Diagnosis is bipolar disorder with manic episode. Nocturnal enuresis management is behavioral therapy. Next, man came with bizarre presentation to hospital. Some collateral person gave history of earthquake few months back. Person neither remembers personal information nor why he came to a hospital that is 100 kilometers away from his home. Answer: dissociative amnesia. Now, radiology questions: linear acceleration mechanism, X-ray, subarachnoid hemorrhage investigation of choice, NCCT. Image based question with adder head sign, uretrocele. Next, X-ray image showing eggshell calcification, silicosis. Next, patient presents with brain hemorrhage, NCCT shows intracranial bleeding. Person has contralateral face, arm and leg weakness. Location of CNS bleeding is basal ganglia. Anesthesiology questions: identify the image, FTCO2 is the answer. Next one, image shows neuromuscular monitoring of a patient after giving anesthesia. Most commonly used nerve is ulnar nerve. Function of the marked part of the image. Answer: prevents aspiration. Next, patient is RYR gene positive and develops malignant hypothermia in the OT. It is a disorder of which channel? Answer is calcium. Next, spread of infection from anus to vagina is prevented by answer acidic pH. So that's it, guys. And few questions, 1 or 2 questions were repeated, but instead of that, you can add up. There was one more question about the blowout fracture, and there was also a question about the fluoride levels of a person from Assam, and another question similarly related was the vitamin C levels. So that questions you can add, and that's it, guys. And if there is anything which is being missed out or anything, and one more question was there. A female had come with mentioning that there was a doctor had removed her uterus, her ovaries along with performing another surgery, and the consent wasn't taken, so that is a violation of. Answer is informed consent. So that's it, guys. In this video I've tried to compile almost all the questions which I've got, and if there is any queries, please do mention about it. And if you are someone preparing for Neetpg, please watch this video, and also please check out all the Neetpg PYQs if at all from my source or from my PDF or otherwise from anywhere else. I've just compiled it in such a way that it's easy for you to recap in my PDF. It's just provided the small explanation and a quick recap model. But anywhere from anywhere, please do the PYQs. Don't miss out on them because they are mark determining. So that's it, guys. Till I come back with my new video. Stay tuned. Till then, bye.